Hi, I'm Dr. Heather Hirsch, and welcome to my channel, Health by Heather Hirsch, where we discuss everything perimenopause, menopause, and hormone replacement therapy. In this week's video, I want to answer the question, how do I know if I'm in perimenopause? I get this question all the time from my patients, in my DMs, from my best friends. And it's not always easy to tell, especially because there's so many things going on in life. Now, some of you may just be learning the word perimenopause because it is sort of a newer word in our zeitgeist, but I'm going to explain what it is, how to tell if you're in perimenopause, and a little bit on how you can treat it. So if those things are interesting to you, stick around. If you don't know me, I'm Dr. Heather Hirsch. I am a board certified internist. I completed 2-year fellowship training at the Cleveland Clinic in all things midlife and menopause. I have a private telemedicine practice, and I also have an academy filled with courses for clinicians who are also interested in learning all this information, as well as courses for allied healthcare professionals and women alike. So check those all out in the descriptions below. Let's start with answering the question, what is perimenopause? If you clicked on this video because you're like, I've heard that word, my friends are talking about it, I'm also wondering if I'm in perimenopause, let's just first start by taking a big step back and defining what perimenopause is. Now, it's actually easier to define perimenopause by first defining menopause. Menopause is when it's been 1 year of no period, so 12 months, no periods. That day you can celebrate and say, this day is menopause, and every day after that, a woman is considered postmenopausal. Perimenopause, therefore, is all the time leading up to menopause when a woman is experiencing a decline in her female sex hormones, namely estrogen, progesterone, and testosterone, maybe having all the same symptoms a woman is having who is postmenopausal, yet she is still getting her period or ovulating. Now, some women will ovulate and not get periods if you had an IUD or if you had a hysterectomy or an ablation. Some women will not be ovulating because they're on medications that stop ovulation, like birth control pills or some GnRH agonists like Lupron or Orlissa. Those are a little bit more complicated cases to figure out if you're in perimenopause. But basically, it is when you're having menopausal symptoms, but you're still having periods or you're still ovulating. We now know that perimenopause can last anywhere from 1 to 10 years. And this is sort of interesting because if you're like, yeah, if you're a menopausal woman watching this for your friend or etc., or you just like all my videos in general, like, I noticed that my symptoms did start at 39 and menopause was at 47. That would actually make sense. But what makes it so difficult for women to know if they're in perimenopause is there's so many things happening at the same time. Our lives are full of stress. We may be at the peak of our careers. We have houses and spouses and pets and finances. We may be getting promoted finally at the same time as our kids are applying for college, or we're really struggling with finances at that time because we're thinking about if we want to slow down or when will we ever be able to slow down. And so you're like, is it stress? Is it anxiety? Or is it perimenopause? Is it insomnia because I have so many things on my plate and I'm doing too much? Or is it perimenopause? And so these symptoms can go on for a really long time. And as women, we try to acclimate. In fact, I have a very famous story of having hot flashes for about 3 to 6 months, always thinking it was just because it had gone from summer to fall and the heat started turning on me. And I am a bona fide expert in this. It took me a few months to realize that I was in perimenopause. As my hair was kind of falling out and breaking, I thought I must just be stressed. I am doing too many things at once. But it could also just be perimenopause. So if you are having that struggle of is it this or is it that, don't worry, I had it too. And so I'm here to kind of help you figure out and hash out which could be which. Here's some pretty telltale signs that you might be entering perimenopause. The first telltale sign is that periods might be changing, okay? So if you're someone who is pretty regular, on the dot, and all of a sudden periods are changing, or maybe they're not increasing or decreasing in frequency, but they're lighter or they're heavier or they have more clots than usual. All of these things could be signs that you are, in fact, in perimenopause. The big reason for this is as progesterone declines and estrogen becomes more volatile, this can absolutely change your periods. And that's exactly what's happening as those hormones are slowly declining and our body is getting used to that as we enter into menopause, even though menopause might not be for years, this is a little bit like puberty in reverse, but we're just experiencing this a little bit more drawn out because now we're more acutely aware of our bodies than maybe we were at, 10, 11, or 12. For this reason, I'm gonna highly recommend throughout the rest of this video that you start journaling and tracking your symptoms. This is going to be so helpful so that if you go to a clinician to talk about perimenopause, you have, months, if possible, of all of these symptoms and their patterns, because there does tend to be some cyclic patterns to perimenopause. So we just started talking about the first telltale sign, which could be change in periods, although that doesn't mean it has to be change in periods. And you want to start journaling and tracking right away so you can kind of get more of a history about what's happening to those periods. Now, you might be saying, I'm a woman who doesn't get periods. I have an IUD or an ablation or a uterine artery embolization or a hysterectomy. So that's okay. You can't track periods. We're going to go heavily based on your symptoms. Now, you might be saying, I'm one of those women that's on a birth control pill or something to stop me from ovulating. Okay, we can't use periods. We're going to go with symptoms. So let's get into some of the telltale symptoms. Telltale symptoms are really going to be a lot like menopause, but as the estrogen's declining, you're going to have more hot and dry. So hot flashes, night sweats, dry skin, itchy skin, vaginal dryness, pain with intercourse, itchy ears. This is kind of your hot and dry. So look for that, especially before you might be having a period if you are one of the women who gets periods, because estrogen declines the most right before the period. So if you're now thinking to yourself, yes, Heather, I always get hot flashes the week before I'm about to bleed, and that's changing too, that is a telltale sign that this is perimenopause. Other low estrogen symptoms can be brain fog or trouble concentrating, or even things like low mood or depression, because actually estrogen is a natural antidepressant. And so you might find your mood plummeting right before your period, or you might find more brain fog or more trouble concentrating. And because with perimenopause, there tends to be this up and this down, again, as you're journaling and tracking, you might again start to see some of those patterns. As testosterone is declining, there can be low libido, and some women, but not all, find that right before ovulation, where there is a natural testosterone spike, that they actually have a higher libido. And if you kind of now are going through the cycles and you're like, there is no libido spike anymore, that could be another perimenopause telltale sign. As progesterone is steadily declining, this is actually what causes a lot of the spotting or heavier periods, because progesterone is kind of like the glue that holds the uterine lining together and it helps to make those menses pretty regular. So as progesterone is declining, this can cause, the spotting in between periods, or the more heavy or the more prolonged or the more clotting of your periods. And because progesterone is a natural kind of relaxing hormone, this is also why some women will find increasing anxiety and especially trouble falling asleep or sort of shutting your brain off at night as that progesterone is declining. So you're gonna say, those all sound very symptom-based. What is the telltale lab test that I'm in perimenopause? There is not one. There is not one. There is no lab test that tells you you're in perimenopause. Now, let's compare this to high blood pressure. We know that there's a certain number on that blood pressure cuff that says you have hypertension when this has happened more than once. For diabetes, if your A1C level is above a certain threshold, we can, point out and say, this is trending towards pre-diabetes, or now this is going to the diabetes range. There is nothing like that for perimenopause. This is why journaling and tracking is so important, because it's a clinical diagnosis. What does that mean? I'm the clinician. I decide. When I see enough of these symptoms, that actually tells me you're in perimenopause. You can never be too young. You can never be too old. Now, not all women will have perimenopausal symptoms that are severe. Some women will. It's all very different, but all women will eventually go through perimenopause on their way to menopause. One other telltale way that you can tell if you're in perimenopause is, drumroll please, you can actually trial postmenopausal hormone replacement therapy. It's something that I do for my patients every single day. We do at the collaborative, my private telemedicine practice, every single day. What this will actually do is, as we try hormone replacement therapy, let's say you're coming in complaining of hot flashes, night sweats, and brain fog before your period. So what we might do is say, that sounds like the estrogen's declining and that's really impacting your brain. Let's try replacing estrogen that week. If it gets better, that really helps to cinch that really was perimenopause. If you're like, oh, I'm having so much anxiety, and maybe we try hormone therapy and you're like, nope, no different. Well, then maybe it is the anxiety in your life, and maybe cognitive behavioral therapy would be more helpful. So the cool thing about using postmenopausal hormone therapy in perimenopause is it can be very diagnostic. It can either kind of rule it in or help you rule it out. And that, my friend, is one of the most amazing things about using postmenopausal hormone therapy. Now, very, very often my patients find so much relief, and we talk to our patients all about the safety and efficacy of using postmenopausal hormone therapy in perimenopause. It's absolutely a myth that you can't use hormone therapy until you're 1 year of no period. I do hear that a lot on my social media. I hear it in my DMs, comment below. If your doctor ever told you this, it is a myth. Why is it a myth? Because many clinicians would be happy to prescribe you birth control pills, which is a form of hormone replacement therapy, right? So why can't we use lower, safer doses, transdermal doses, bioidentical but FDA-approved hormone therapy if you're struggling in perimenopause? We absolutely can. So treatment of perimenopause is going to depend on when you have your symptoms, how bad your symptoms are, and what your periods are doing. Now, I'm so excited, if you've gotten to the end of this video, to announce that hopefully by the end of the year, I'm gonna have a new book coming out called The Perimenopausal Survival Guide. Yeah, that's right. I wrote my first book, Unlock Your Menopause Type, that came out in 2023, but there is so much information simply on perimenopause alone, and I was looking across the shelves and didn't see books that were dedicated solely to perimenopause. And so I'm so excited. So let me know if you're excited for that to come out. Now, I hope this video is really informative and helpful. I know that because it's a clinical diagnosis, it's frustrating because you just want to be able to cinch it. But let me tell you something. If you're watching this video and if you're wondering if you're in perimenopause, you probably are, right? All women are going to go through perimenopause, and they're going to feel different severities of symptoms at different times. Knowledge is power, and I am so hopeful that this video has given you a little bit more confidence, a little bit more knowledge to be proactive, speak up for yourself, and find the right thing that's going to help you thrive through perimenopause. All right, ladies, I will see you next week for a brand new episode. Bye, guys.